Hi, I want to talk today a little bit about nutrient deficiencies and why they might be the cause of what is making you sick. And I'm going to use B12 as a specific example because most people have heard of B12 and it is a common deficiency. In fact, the USDA estimates that 40% of Americans are deficient in this vitamin. And if you're over the age of 60, that number increases to 50% have a deficiency. So clearly, millions of Americans are walking around with vitamin B12 deficiency. And you might be thinking, well, what's that have to do with anything? Well, what it feels like to be deficient in B12 is lacking energy. Fatigue is a big, huge player in B12 deficiency. Headaches, chronic pain. Know anybody that has these problems? These are what walk into every doctor's office every day, all day. And so very nondescript, generalized symptoms. And you can see that if you have this problem, you want to know what's causing it. And automatically we jump to some scary diagnosis and things like that. And when in fact our medical system is really good at waiting until we have something broken down, diagnose as a disease so that we can match up a drug or a surgery and fix it that way. But when you're looking at nutrient deficiencies, they are the things that they show up before the actual disease in most cases. They're the warning lights. They're the check engine lights that we are just not looking at in mainstream medicine. When is the last time that you went to your medical doctor and they really asked about what you were eating and like food journal style? Are you getting enough greens and are you eating meat for B12? And you know, have you had your nutrient profile tested to see what might be missing? If you consider that your body is a series of chemical reactions and each chemical reaction requires the right building blocks in terms of nutrients, then you will see how important it is to identify these things early before they become a major problem. Most chronic disease, for example, takes 15 plus years to show up as a diagnosable entity. So what if you could go backwards and look at all the things that you're missing and fill in the gaps before you got to the point where you're diagnosed with something big and scary? So I just use B12 as an example because it's common. It's one I see low on a lot of people, and it's easy to talk about because it has a lot of symptoms. And we're tempted to dismiss the idea of nutrient deficiencies as, oh, it's not that big of a deal, or, you know, why should I care about that? But what this looks like and feels like is I'm too tired to devote the time and energy I need to my kids and my family. I'm too tired to hustle to grow my business or to earn the promotion I need at work. I'm saying no to people that I care about that want to do things with me because I'm too tired. I have headaches, and so I make excuses not to do things. And you can fill in the blank with whatever that is for you. But that's what they look like, and they are major players in this overall picture of health. So I just want to, ask you, have you ever thought of nutrient deficiencies being a part of the equation in why you don't feel and perform the way that you want to? And if you hadn't, it's an invitation to think of something new that maybe you haven't thought of that could really change your life and improve your health in major ways. I see it all the time, so I wanted to share that with you.